First thing is the decision, the important thing is the decision whether or not to take a radiograph, because ionizing radiation, which is what dentists use, that is x-rays, have a risk associated with them. So this question of protecting the patient and protecting the operator, which can be the dentist or an auxiliary. Protecting the patient, remember, you take a radiograph only if there's information you think is hidden from you that prevents you from doing a proper diagnosis. And then you take the minimum amount of radiographs consistent with a proper diagnosis. The operators are protected through various means. One of them would be standing at least 6 feet away from the X-ray unit, because the intensity of the radiation, the X-rays drops as 1 over the square of the distance. So if you're 6 feet away, for instance, the intensity is 1/36, so it's essentially 0. And of course, I just remembered another way to protect the patient is using, when you're doing intraoral radiographs, a lead thyroid collar, a lead apron, which helps further reduce exposure to the patient. But for the operator, the main thing is to be far enough away from the beam so that the intensity of the beam is low, not to have the beam direct. The beam should be directed away from the operator. The button to take the radiograph is always outside the room, and if you don't have that kind of distance, then you can put a barrier, a lead barrier, between, like a door, between you and the patient. But generally, distance will do it. But when you're designing an office, all those things have to be taken into account. Where is the machine? Where is the waiting room? Where are your patients waiting? Because you have to protect them. You have to protect the operator. You have to protect the patient. And there are codes to follow. And then when you're setting up an office, your office will be checked by the local Department of Health to make sure that your machines are operating properly and that you've taken proper precautions to protect the patient and the patients in the waiting room and the staff, which could be a receptionist, and also those taking the radiograph. So it's a very good question, and it's not a simple answer, but there are procedures and steps that are clearly explained in various documents in the profession. One of the most interesting cases, I have to think back over a lot of years, but one that pops into mind is a family that had through 4 generations manifestations of an inheritable disease called Gardner syndrome, which involves multiple supernumerary teeth, impacted teeth, missing teeth, bony tumors of the jaws, GI tract problems like colon polyps, higher risk for cancer, and we were able to get genetic tests and radiographs covering 4 generations. That was quite interesting. Maxillofacial radiology is quite unique. I feel different from the other dental specialties, and it's the reason that I chose it. In fact, I chose it coming as a physicist because I think it's the most cerebral of all the dental specialties. That is, it involves diagnosis, which requires thinking, deductive reasoning, and there really is no technical skills that you have to learn as a general dentist. And that's one of the reasons I gravitated towards maxillofacial radiology. And I found that people in the field have very broad scientific backgrounds, and the research related to maxillofacial radiology covers many disciplines, from basic imaging disciplines and just producing a better sensor to radiation biology and so on, to diagnosis. So in that sense, it's very different, say, than orthodontics or oral surgery. If you're interested in becoming a maxillofacial radiologist, of course you first get a undergraduate degree in general dentistry. I would recommend that before you specialize, you take a residency and get some more experience in general dentistry, because you will be a better maxillofacial radiologist if you understand general dentistry more, and also you will be able to help the dentists that refer patients to you for imaging. You will be able to help them more in terms of making recommendations once you've made your observations when you read the radiographs you've taken. But after that, but you don't have to get a residency, but I would advise it. But generally, after your undergraduate degree, then you need a postgraduate degree, and there are a number of excellent schools in the United States. It's generally a 3-year degree. I would recommend doing it with a master's thesis so that you learn to do research. The reason why is that probably the best career, the best way to use your radiology is in an academic setting, in a university setting. And in a university setting, you'll enjoy it much more if you're able to do research also. So if you do your postgraduate degree, do it as a master's degree, and you'll do a thesis and do a research project, and you'll learn a lot from that. And some of the excellent schools, for instance, I went to the University of Texas Health Science Center in San Antonio. University of North Carolina has an excellent program. University of Iowa, some excellent program in University of Toronto in Canada, and so on. So it's then basically your undergraduate degree, and then a 3-year postgraduate degree with a master's. And I would advise some general dentistry in between, just to get to be a general dentist and understand general dentistry much more. And again, I think you would apply it most likely. I think you should think about an academic setting. It is possible to do radiology as a private practice, but most maxillofacial radiologists do it as a part-time private practice, and they're full-time academicians, full-time instructors at a dental school. And that makes for a very nice, well-balanced life. And if you want a full-time position in a university or dental school, you have to have some kind of recognized specialty. And incidentally, radiology is the most recently recognized dental specialty. I think it was something like 7 years ago, 2004.